Welcome to audio session 14. In this session, we are going to focus on behavioral therapy, which also is an integral part of overcoming social anxiety. Actually, we have been doing some behavioral work already. By this I mean that we've been taking some of the therapy we've been doing and using it in the real world, in real-life, practical situations. We've been using slow talk in social situations to help reduce our anxiety and make us feel more in control. By now, you know that feeling more in control is very important in learning to overcome social anxiety. The cognitive handouts you have been practicing every day and the specific statements you have written should be popping into your mind by now and helping to lessen your anxiety even in real-world settings. Even the attitudes that we practiced should be coming into your mind now when you face real-life anxiety thoughts and situations. As we look forward to events, we know that the old anticipatory anxiety and worry is nothing more than an ant's lie. So our new thoughts are, who cares? So what? Why should I be dwelling on this? And it's no big deal. What we haven't talked about yet is how to put this all into place in the correct way. We can't simply go out there and with a snap of the fingers say, work. It used to make me very mad when people told me to snap out of it. If I could have snapped out of it, I would. After all, who wants to live with social anxiety disorder? So there is a right way and a wrong way to put our behavioral therapy into practice. The following handout, called a balance sheet for facing anxiety, gives us a good idea of how to proceed. A balance sheet for facing anxiety. Notice the two extremes above. On one side, completely avoiding activities and situations only makes us more fearful and anxious. The more we consistently avoid situations, the worse our social anxiety becomes. On the other side, however, flooding yourself with highly anxiety-producing activities does not work in alleviating social anxiety either. Instead, it typically reinforces our feelings of inadequacy and makes us even more anxious than we already are. The solution to this dilemma is to, number one, start behavioral therapy, which is what you do in the real world, slowly. Number two, as you begin, plan to do something that is only slightly anxiety-producing. Number three, imagine the scene in your mind ahead of time. See yourself as handling the situation with calmness, relaxation, and peace. Number four, use the peace zone concept that we discussed, or the relaxation technique of your choice, such as loosening up, to calm yourself down. Number five, use your rational statements before you do a behavioral experiment. For example, say to yourself, saying hello to a stranger was something that used to cause me anxiety in the past. Things are a little easier now, and I think that it may not be that big of a deal. Here you are turning the tables on the ants by going neutral. Number six, repeat the slowing down or peace zone feeling and your rational statement concerning the event several times, but keep an external focus. By doing something, thinking about an interesting thing coming up later in the day, or distracting yourself by doing something engaging and fun. Number seven, use any rational self-statement to begin changing your thought processes. Go neutral to start with and use all the maybes and possiblies that you wish. You are still challenging and breaking up your old beliefs when you turn the tables on the ants. Number 8. When you are cognitively prepared, go ahead with your experiment, one step at a time. But remember to start slowly at the bottom of your anxiety hierarchy with an activity that only causes you a small amount of anxiety. 9. Expect a small amount of anxiety, but continue to use any strategy that lessens it. 10. Focus on the external situation. What is someone saying to you? Listen to them and their words as best you can. You are in your peace zone, and there is no need to focus internally on yourself. Focus outwardly on what is happening in front of you. 11. If you find the anxiety is too strong, you have done all you can for the moment, so feel free to leave the situation. Number 12. Notice you are successful because you tried, regardless of how you interpret this experiment. We must learn to give ourselves credit and not beat ourselves up when we stand up to an anxiety situation and actually begin working against it. 13. Congratulate yourself for carrying out the experiment. The fact that you tried is a victory in and of itself. This is something you were not doing last week, but you are doing it this week. That is a small step, and it is progress, and you did it. That is all that's important. This is a fact, and it is rational. You did what you needed to do, and you survived. 14. When you feel ready, move up to a slightly more anxiety-producing situation. That is, move your anxiety hierarchy up a little bit. The situation will cause you to be a little nervous, but should not cause a high amount of anxiety. 15. If you find a situation too anxiety-producing, move down on your hierarchy. At first, it may be tricky to know where you fit on your hierarchy, so it is fine to trial and error this. Regardless, however, this is another victory, not a defeat. Again, any time you try something, you must learn to see this as a victory. There is no way you can fail if you keep trying. The only way you can fail is if you give up and quit. So start slowly, move slowly, but make a start. Move very gradually into the situation you have been avoiding. Always move into your peace zone and allow yourself to feel the relaxing emotions it can produce. Always use rational self-talk that you have personalized just for yourself. Always give yourself a lot of credit for trying. Most people are not as courageous as you are. It takes courage to meet anxiety and stand your ground. Realize that you are brave for deliberately doing something that is anxiety-causing. As time goes by and you practice these steps, you'll know you're making progress and getting better. Do not try to move too fast. Patience is always necessary. When you try to rush, it never works. Move gradually, follow your hierarchy of anxiety, and make it a step-like process. Until you are firmly planted on your current step, do not try to make any more upward movements. Go slowly, take it easy, but always keep on going. The little steps add up very quickly. Your step-by-step progress, your step-by-step hierarchy, is very important. This is the place at which many people get stuck. Because we all want to get better as fast as we can, sometimes we try to rush things. It will not work if you try to rush your behavioral experiments. They need to be addressed one by one in a logical, step-by-step, hierarchical process. You need to feel a sense of achievement and confidence before you move up to your next anxiety-producing event, which is the next step in your behavioral hierarchy. This is the general pattern we always want to follow as we take our cognitive strategies out into the world and face real-life situations. These situations may be difficult for us to contemplate, but if we handle them in the manner just explained, we are making steady progress toward feeling less and less anxious in these real-life situations. So move up slowly, rationalize everything in your mind, and stay away from beating yourself up. Please look at your next behavioral handout. It is titled The Power of Acting. Notice these handouts are different than the cognitive handouts because they relate directly to the anxieties you face in the everyday world. The power of acting. This is a big paradox, but it always works. Number 1, taking control of the situation, or the good old boy, good old girl routine. Act a little more friendly when you can. Be proactive and say hello to other people first. Smile a little more. Greet people in an assured voice rather than a hesitant one. For example, "Hey there, John." "Here he comes." "Did you survive the evening?" "Okay, so how was the date?"